Now we have discussed about immediate change, we have discussed about early change. Now we'll be moving on to what is called as late change. Right? What is a late change? See, late change is basically decomposition. I told you the body is disintegrated, body is destroyed. You need decomposition. Otherwise, if there, imagine that there is no decomposition in the earth will be filled with dead bodies only. Right? You need decomposition to happen. Right? Body is disintegrated, body is dissolution. Right? Now what happens? See, I told you there are two important process of decomposition. One is autolysis, which is nothing but self-destruction. It is done by lysosomal enzymes. Lysosomal enzymes. Our own endogenous lysosomal enzymes. That is the point. Okay. If they ask you what is the first external sign of that, you can say it is clouding of cornea. Clouding of cornea is what you see first externally. Autolysis. The other process is basically putrefaction, which is more important for your examination purpose. See, putrefaction happens by bacterial enzymes. Disintegration of the body by the bacterial enzymes, you call it as putrefaction. Right? Bacteria is going to produce enzyme that will destroy the body. But which bacteria? What are the bacteria involved in this? You can tell anything. E. coli, Staphylococcus, Streptococcus, bacteroids. Right? Because basically the source of this bacteria is from GIT, gastrointestinal tract. But what is most important bacteria? The most important bacteria is this fellow. That fellow is none other than Clostridium welchii. This fellow can be called as the chief destructive agent. In putrefaction, this fellow is the chief destroyer. Chief destructive agent in putrefaction, that is none other than Clostridium welchii, because you can see the production of lecithinase enzyme from this fellow. The lecithinase is one of the very important enzyme in putrefaction process. It can cause hemolysis, it can cause lysis of the proteins, fat, thrombus, everything is lysed by this lecithinase enzyme. And since the lecithinase is produced by Clostridium welchii, you can say this fellow is a chief destructive agent. Chief destructive agent. Now I told you who's the reason for this putrefaction, right? Now we'll be moving on to what kind of exchanges that you can expect. Number one, you can see the color change. You can also see the gas production. And do remember, the third one is liquefaction of the tissues. Right? Liquefaction of the tissues. Right? When I write in sequence, color change, gas production, liquefaction, don't think that it goes in chronological order. It doesn't go in sequential order. All the changes occur simultaneously, destroying the body. Right? For learning purpose, we have listed one by one. Fine. And this liquefaction of tissues is also called as colligative liquefaction of the tissues. Right? So remember, it occurs by 5 to 10 days after death. 5 to 10 days. Now let us discuss the changes one by one. To start with, the first change is color change. Let's talk about color change. When you talk about color change, you can see the first site of color change. Where do you see the first site of color change? Overall it is iota. Overall it is iota. But in the iota, what is the color that you notice? You notice reddish brown discoloration. Right? Reddish brown discoloration of the aortic intima is what you notice. Right? Earlier it was greenish discoloration in the subhepatic space. But now it is the latest update is the overall, the first site of color change is reddish brown discoloration in the aortic intima. That is the first site overall. But if they ask you externally, we cannot see the aortic intima externally, right? So externally, if you notice, what is the first site of color change? The first site of color change is a greenish discoloration or greenish patch in the right iliac fossa. And you can say, if you are able to see a dead body with a greenish patch in the right iliac fossa, that means putrefaction has started just now. It has started. In other words, you can see this is the first external sign of putrefaction. Right? This is the first external sign of putrefaction. Very, very important. First external sign of putrefaction. Later what happens? Initially it is in the right iliac fossa. But why in the right iliac fossa? Why not in the left iliac fossa? Right iliac fossa is where you have cecum, which has got lot of bacteria, and it is very close to the skin. Whatever changes that is occurring in the cecum, it is very easily visible in the right iliac fossa. Initially it is seen in the right iliac fossa, then it is spreading throughout the abdominal wall, right? Then you can see the discoloration of the entire body. Right, so if they ask you what is the first external sign of putrefaction, it has to be greenish discoloration in the right iliac fossa. There is a specific time for that. In summer, it takes 12 to 18 hours, whereas in winter, it takes 1 to 2 days, which will help us to find out TSD, time since death. Right? There is one more important finding that you have to notice on the skin. For that, I'll tell you the concept. Let us assume that this is the blood vessel. Normally, the bacteria spreads through the blood vessels only. Right, because blood is there, which is a nutrient medium for the bacteria. It keeps on utilizing, spreads through the blood vessel. Assuming that this is the bacteria, as the bacteria keeps spreading, it produces gas. The most important gas is hydrogen sulfide. The hydrogen sulfide, which is combining with the hemoglobin present in the blood. In the blood already you have got hemoglobin. The hydrogen sulfide combines with hemoglobin to form what is called as sulfhemoglobin. Right? This sulfhemoglobin is a green color pigment. It's a green color pigment. It is going to stain the inner layer of the vessel wall. It is going to stain. If this is the blood vessel, all the inner lining of the blood vessel will be stained with the sulfhemoglobin. So when you see from outside, you would be able to find out something like this. Right? On the skin, you will be able to find out something like this. You can see linear. You can see green color markings on the skin. Green color markings on the skin. Particularly, it is seen on the flanks. It is seen on the shoulder. All these regions you can see very prominently. Right? If you see linear green color markings like this, do remember this specific phenomenon is called as marbling. Right? One of the most frequently asked questions from this putrefaction change, that is marbling. Very, very frequently that you get in the examination. It will be an image-based question. Have a look at the marbling. This is how it is. Right? Sometimes it is green, sometimes it is dark brown, and it can also, it will be green in color. Sometimes it will be visible as dark brown. But do remember it is marbling, and you need to know that it is a staining of the blood vessel wall. So it is stained along the blood vessel. This staining will be along the blood vessel. It follows the blood vessel. Right? It is following, because it's basically staining of the vessel. Right? So it is following the blood vessel. Now, when you have a look at this marbling, I told you that you will see something like this, right? But here you need to know, they can ask you, what are the questions they can ask you? They can ask you, what is the color? Green color. What is the pigment? Sulfhemoglobin. The next point they can ask you, why should you learn this? You should learn this because this will help us an idea. This normally happens around 36 to 72 hours after death. So this will give us an idea about time since death. Right? This will give us an idea about time since death. That is a medico-legal importance. Do remember 36 to 72 hours. Again, this was asked multiple times in the examination. So you need to be knowing this before going to the examination. Right? So this is called marbling. Now going forward, I told you the second change. The second change is gas production. The second change is gas production. Right? Wherein you have lot of gas getting produced. You can see carbon dioxide, carbon monoxide, ammonia, hydrogen sulfide, lot of gases, mercaptans, lot of gases are there. If they ask you which is the most important gas in decomposition, the most important gas is nothing but your hydrogen sulfide, and that is the reason why you see lot of greenish discoloration in a decomposed body. Right? Sulfhemoglobin. Fine. Now, what is the consequence of lot of gas? Number one, when you have lot of gas, what happens is, number one, you can see post-mortem skin blisters. Right? You can see post-mortem skin blisters. And suppose if you are able to see the blisters on the dead body, you are not sure whether it is due to decomposition or there may be some burns injury. How would you know whether it is due to burns or whether it is due to decomposition? How would you know whether it is due to ante-mortem blister due to burns or it is post-mortem blister due to decomposition? This is post-mortem blister due to decomposition. This is ante-mortem blister due to burns. How do you differentiate? I'll tell you the easiest point that you have to remember. If it is ante-mortem blister in a burst, remember the content will be inflammatory fluid which is rich in protein and chloride. If it is postmortem blister, what is the content of the blister? What is the reason for the blister? That is gas production. So the content will be gas. And if you look at the base will be reddish. In ante-mortem blister, it is hyperemic, whereas the post-mortem blister, the base will be completely pale. This is the easiest way by which you can differentiate whether it is ante-mortem or post-mortem. Right? The second point due to gas production is you can see what is called as gas rigidity. The body will be completely bloated, body will be distended. You can see the gas rigidity, the abdomen is distended, scrotum is distended. You can see the body, the face is bloated, tongue will be protruding, eye will be protruding. Entire body will be stiff like this. You call it as gas stiffening. Gas stiffening. Remember, when the body is in complete gas stiffening like this, because of the excess pressure that is in the thorax and abdomen, it is going to push the fluid out. Or because of the pressure, there can be some rupture of the capillaries. And because of that, what you can see is, you can see some kind of, right? You can see some kind of blood discharge from the nostrils and the mouth. Right? See this kind of oozing of blood from the nostrils and the mouth, right, which is called as post-mortem purge, right, oozing of the blood, right, it's called post-mortem purging of the blood, right. It is, see, suppose you see a dead body which is in the advanced decomposition state, which is having blood which is coming out from the nostrils and mouth. Do not think it could be a trauma. Do not think it should be violence. It is not. In any dead body which is in advanced decomposition state, this kind of post-mortem purge is expected. That's a normal post-mortem phenomenon. It is not a trauma. You need to remember, it is called post-mortem purge. Right? And of course, like, you will have the gas production even in the organs itself, particularly when you take a liver. In the liver, what you can see is, you can see lot of air pockets can be there, gas pockets will be there. We call this as foamy liver, or it is also called as honeycomb liver. It is called foamy liver, it is called honeycomb liver, that you can notice in this. Right? So do remember, these are all the changes that you can see because of gas production in the body. Now going forward, the third thing that I told you is in liquefaction of the tissues. Right? Liquefaction of the tissues, all the organs will get liquefied, all the organs will get disintegrated, decomposed. Right? I also told you colloidal liquefaction, which happens around 5 to 10 days. Fine. Now, suppose if you want to discuss about organ-wise, what is the order of putrefaction? Sometimes they can ask you, what is the order of putrefaction? In which order the organs getting putrefied? The first, earliest is larynx and trachea. Larynx and trachea, that is the easiest one to remember. Earliest one. What is last organ to decompose? Remember, which is the hardest part of your body? The hardest part of your body is bone and tooth. That will be the last organ to decompose. Because so hard, bone, right? You exhume the body, after 10 years also still you will find the bony fragments, skeletal remains will be there. Right? That is the last organ to decompose. Now let us say, right, late organs. Let's talk about late organs. It's not latest, it is not last organ, late organ. Organs which putrefy later. Right? In a case of male, it is prostate. In a case of male, it is prostate. In a case of female, it is uterus. Right? And do remember, it is nulliparous uterus. That is again important. Gravid uterus will decompose early. That is because in a gravid uterus, you can see lot of vascularity. I told you, bacteria will spread through the blood vessel. More blood supply, more decomposition, it will decompose early. But in nulliparous uterus, relatively, the blood supply is less, and that is the reason why decomposition will be late. Right? In addition to that, you can see skin, tender. These are all the organs will decompose late. Now, what about early organs? Right? What about early organs? We have discussed about earliest, we have discussed about late, we have discussed about last also. Early organ. This is again very important, right? You may get a lot of questions from that. You need to remember it is stomach, intestine, spleen, right? I told you the source of bacterial decomposition is from GIT only, right? The source of bacteria from for a decomposition is GIT only, and that is why anything that is associated with the alimentary tract will decompose early. Stomach, intestine, spleen, right? Liver, brain, and heart. Right, this sequence is very important. This sequence is very important, but you can see that it is more of factual. You need to memorize it, but I'll try to make it easier for you. That is what I'm doing. You can see the mnemonic sister. Lily's beautiful heart. Sister Lily's beautiful heart will tell you the sequence of the early organs. What is that, sister? SIS will refers to stomach, intestine, spleen. LI for liver, right? B for brain, and H for heart. That is again important. Few years back in one of your NEET exam, you got a question like this. Which of the following organ decompose early? Option A, prostate. Option B, kidney. Option C, brain. Option D, myocardium. Many of the students, they chose myocardium, right? Thinking that they got confused with rigor mortis. Only with regard to rigor mortis, it is myocardium. But if they ask about putrefaction, remember, even before myocardium, the brain should have been there, right? So the answer for that question is brain, not myocardium. So this is something factual, I do understand. For making it easier, I have given you the mnemonic. So do remember this mnemonic. You will remember the sequence. Fine. So that is about the order of putrefaction in organs. So I have told you everything in putrefaction. You can see the color change. You can see the gas production. I have also told you about liquefaction of tissue. So we were discussing about putrefaction. Right? See, if you see any body which is completely putrefied, they say that this is the surest sign of death. Surest sign of death. When you talk about rigor mortis, algor mortis, they mentioned as sure sign of death. Sure. Whereas putrefaction is the surest sign of death. Superlative degree, right? The surest sign of death. Right? Because a normal body, when a person who's alive, the body will not putrefy, right? So when the body is in putrefaction, that means the body is, it's a surest sign. The person is completely, definitely dead. Right? See, certain poisons will delay putrefaction. Certain poisons will delay putrefaction. What are they? Right? You can easily remember. There is a long list, but I'll tell you what is so important. You can remember State Medical Council, SMC. What is that SMC? S for state, Strychnos nux wherein you can see delay in the putrefaction. Metal, right? Metallic poison, generally you see delay in the putrefaction process, right? And C for carbolic acid. C for carbolic acid. Phenol poisoning delays putrefaction. Right? Strychnos nux metallic poisons, carbolic acid. Metallic poison, you have arsenic, antimony, thallium, all these things will delay the putrefaction process. Fine. Now let's go forward. See, when you have three dead bodies, one is in the air, one is in the water, another one is in the earth. You are buried that thing in the earth. Bury the dead body under earth. Which will decompose fastest, which will decompose slowest? See, the one which is present in the air will be decomposing fastest. Right? The one which is buried, it will be decomposing slowest. You can remember soil is there. So S for yes, it is slowest. Right? Easy to remember. S for yes. Soil means slowest. But here, if you want to know the rate, 1:2:8. 1:2:8. Sir, it is 8 more. So the soil decomposition should be more. It's not like that. It is a time taken for the dead body to decompose. If it takes only 1 week to decompose in air, it would take 2 weeks in water, twice the time, and it would take 8 weeks for the body in the earth to decompose. Right? So 2 times more, 8 times more. Right? Or you can say 2 times slower, 8 times slower. This is the rate of putrefaction. This is the rate of putrefaction in different medium. Depending on the medium, the rate of putrefaction will change. And this is called as Casper's dictum. Right? Do remember, this is called Casper's dictum, which is basically the rate of putrefaction in different medium. Remember, 1:2:8. You can also remember awesome. Right? You can also remember awesome. Air, water, earth. That's an easy way to remember. Air, water, earth. Fine. Okay, let's go forward. So we have seen the normal putrefaction process in a normal environment. What if the conditions are modified? For example, right, if the climatic conditions are modified, you get modified forms of putrefaction. Number one, it is adipose air. Number two, it is mummification. Right? Number one, it is adipose air. Number two, it is mummification. Two important conditions that we are going to discuss now. Fine. See, adipose air. Adipose air. Cut the word adipo into sear. You can see adipo is converted into sear. What do you mean by adipo? Adipo means fat. Sear means wax-like substance. Wax-like substance. What happens here is whatever fat that you have in the body that is converted into fatty acids. Right? Whatever fat that you have in the fat body that is converted into fatty acid, that is on the fatty acids you have deposition of calcium and the salts that is converting into soap formation, or you can also say wax-like tissues. Wax-like substance. Right? And this is nothing but, this wax-like substance is nothing but adipose air. This wax-like substance is nothing but adipose air. Fine. Since it is the formation of soap, this adipose air can also be called as saponification. This is also called a saponification process, but the latest update says that it is not true saponification, and better this to avoid this term saponification. And you can also find out the wax-like substance produced in the body, and that is the reason why this adipose air is also called as grave wax. You can see the waxy substance in the graveyard, this grave wax. Fine. Now I told you the reaction. Fat is converted into fatty acid converted into wax-like substance. But it does not happen just like that. Right? It doesn't happen just like that. You need some factors for this conversion. What are the factors that are needed for the conversion? Number one, you need to have warm climate. Right? Not hot climate, warm climate. You need to have water. Moisture is needed. Moisture is needed. You also need Welchii. Right? Clostridium Welchii is needed because Clostridium Welchii produces lecithinase. Not only lecithinase is needed, you also need intrinsic lipase. Right? Intrinsic means it is present in the body itself. Right? Intrinsic lipase is the one that is going to start this lysis of the fat. Fat is converted to fatty acid, right? So this is the lipase that is going to lyse the fat. Lyse the fat. And you get fatty acid formation. And this fatty acid formation, right, what are the fatty acids that is produced? You can see palmitic acid and stearic acid. Palmitic acid and stearic acid, they are produced here. Fine. Since you have lot of acids, the pH of the tissue is totally acidic. When the pH of the tissue is totally acidic, the bacteria cannot multiply. When the bacteria cannot multiply, the body will be preserved or decomposed. Right? When the pH of the body is acidic, bacteria cannot multiply. When the bacteria cannot multiply, the body will be decomposed or not decomposed. Do remember, when the pH is acidic, the body will be preserved. Right? You can see the body is completely preserved. You can see the injuries, identification features, everything will be preserved in the body. Right? That is why this is important. Fine. And now you can see that I told you the entire reaction. I told you the entire reaction. You can see the fatty acid converted to waxy substance. Right? Now this reaction is called as hydrolysis. Right? And hydrogenation of fat. The entire reaction, it is called as hydrolysis and hydrogenation of fat. Right? Hydrolysis and hydrogenation of fat. Hydrolysis. Water is there, lysing. Hydrogenation, you add hydrogen, so hydrogenation of fat into fatty acid. That is what we get here. Right? What are the sites that you can see? I already gave you the clue. Fat. So wherever you have more fat, adipose will be more common. Wherever you have less fat, adipose is less common. So if you want me to list it out, I can list it out. What are the sites? The first site is subcutaneous fat. They say that it is the earliest. This is where it starts. Right? And other places like breast, gluteal region, liver, in all these places you can see the adipose formation. I told you earlier, wherever you have more fat, you will see the adipose formation to be more. Right? To be more. For this entire reaction to take place, do remember it can happen in 3 weeks to 3 months. But do also remember, the earliest is noted in 3 days also. You can remember 333. 3 days, 3 weeks, 3 months. 3 weeks to 3 months, that is average. It can be earliest noted in 3 days also. What is the smell of this adipose hair? The smell of this adipose hair is ammoniacal. Right? Ammoniacal. That is why it is important. Fine. Right? Now, what are the medico-legal importance here? I have already given you all the points in this one slide itself. You can easily find out. Since the body features are completely preserved, it will help us in identifying the person. You know what kind of climate is needed for adipose hair. You need warm climate, so you can find out the place of disposal of the dead body. And you also know what is the time that is taken for adipose hair formation. You can also comment on the time since death. Right? So you can find out, you can comment on what is the medico-legal importance. You can comment on the identification. You can identify the person. You can comment on the injuries as well, because that is also preserved. You can comment on the cause of death. Right? You can comment on the time since death, because you know how much time does it take for adipose hair formation. And you can also comment on the place of disposal. Right? When you are able to find out all the things, those are all the medico-legal importance of adipose hair. Very, very simple. Right? You just remember this reaction, you'll be able to find out each and everything in detail. Now moving on to mummification. When you talk about mummification, you can remember whenever the body is exposed to dry and hot climates. Remember, whenever the body is exposed to dry and hot climate, what happens is there is dehydration of the body. There is drying and dehydration of the body. When there is drying and dehydration of the body, you get the body totally shrunk in size and you get mummified body. This is the mummy that you can see. Body is mummified. You can compare, you can see that the body shrunk in size totally. There is complete weight loss of more than 70% of the body weight is lost. Why? Because there is dehydration. Right? There is dehydration. But what kind of climate is needed? You need dry and hot climate, and you need to have free flow of air. When you talk about adipose hair, you need still air. Still air. But here you need free flow of air so that the body gets completely dried up and dehydrated. Right? What is the smell of this mummified body? That was again asked in your previous NEET examination. Do remember, it is completely odorless. There is no smell. When the body is completely mummified, you don't get any smell at all. What is the time taken for this? Do remember, it is 3 months to 12 months. How to remember? Adipose hair I told you, 3 days, 3 weeks, 3 months. You continue from that, 3 months to 12 months will be your mummification. That is another easy way to remember. Right? That's another easy way to remember. Now going forward, I told you what is the medico-legal importance of mummification. Again, you can identify the person, but not just like adipose hair. You can find out the place of disposal. You need a dry and hot climate place is needed. You can also comment on the time since death. Right? So you can easily comment on all the things. But you should also know that this mummification is also seen in, you can see antimony. Antimony poisoning and arsenic poisoning will favor mummification. It will favor mummification process. Right? Certain poisons will favor mummification. That is nothing but your arsenic and antimony. Fine. I have told you modified forms of putrefaction. Now you see, there is something called photoluminescence, postmortem luminescence. There is something called postmortem luminescence. Luminescence means glowing, right? Postmortem luminescence means the body you can see glowing. It is not the body which is glowing because of the organism that is present in the body that is glowing, right? You can see photobacterium fishery. Right? Photobacterium fishery, that is a bacteria. And we also have one more, that is Armillaria. Right? That is a fungus. So these are luminescent when they grow on the body. So you can see the body itself looking glowing. Okay. Let's talk about another technique. That is called embalming. What is basically embalming? It is a technique of preserving the dead body by injecting chemicals. So this is basically an artificial technique, artificial method of preservation. What are the natural methods of preservation? We discussed about that. I told you adipose hair and mummification, that is a natural methods of preservation, whereas this embalming, it is an artificial method of preservation that is also called as thanatopraxia. the art of preserving the dead body, that is also called a thanatopraxia. Right? If they want to ask synonym, you can expect this thanatopraxia in the examination. See, what are the different types of embalming? Do remember, number one, arterial embalming, wherein we are injecting the chemicals into the arteries. Right? Cavity embalming, right? As the name implies, it's about cavity. And you can also say surface embalming, whereas we are injecting in the skin, right? Dermis. You can remember arterial, cavity, and the surface embalming. Fine. And what are the different embalming, what are the different constituents of embalming solution that you need to know? We are injecting embalming solution. It is completely containing of various chemicals. You can see it contains preservative. What is a preservative? You can see formalin is there. You can see formaldehyde is there. You can see methanol is there. All these are preservative. Right? And germicide is also there. What is a germicide? Particularly the carbolic acid phenol. And you have wetting agent, glycerin, wetting agent. Right? Wetting agent. You can see buffer. What is a buffer? Sodium borate. Sodium borate is a buffer. It is going to stabilize the pH. And you can see anticoagulant that will be taking care of the coagulate clotting process. That is nothing but sodium citrate. Sodium citrate. How to remember? You can remember B for borate. That's an easy way to remember. And coagulant, you can remember citrate. Okay, and what is a dye? They use dye. It has got eosin on any other dye. And what is the most important vehicle? The most important vehicle is water, that is H2O. We are injecting liters of chemical embalming solution into the body. I do understand this is very important. From a student's perspective, it's very difficult to memorize all these things. But for MCQ purpose, what you have to remember is ethanol is not a part of embalming solution. Do underline it. Ethanol is not a part of embalming solution. That is one important MCQ that you need to know. Whether you remember the remaining chemicals or not doesn't matter. But what you have to remember is ethanol is not a part of embalming solution. That's what you need to remember. What is the best time to do embalming? Right? Less than 6 hours. Results will be very, very effective. I did not mean that after 6 hours you cannot do it. After 6 hours also we can do it, but the result will vary. It will be the best result. It will yield best result when it is done within 6 hours. When it is done within 6 hours. And what about which is the best injection technique? We are going to inject the fluids, right? What is the best injection technique? You have lot of injection techniques. Continuous injection and drainage. Continuous injection, disrupted drainage. Likewise, you have lot of techniques. You don't have to know anything else, but what you have to know is which is the best. Which is the best? Discontinuous injection and drainage will be the best technique. Right? You inject for some time, wait for some time, and you drain. Right? Wait, again you inject. You discontinuous injection and drainage. That will be the best technique, injection technique we've got. And what about the vessel? Which vessel is going to be giving us the best result? You can use carotid vessels and the femoral vessels. Right? Femoral artery. Carotid vessels and femoral vessels will be useful. Fine. And what is the best technique which was asked in one of your previous JIPMER exam? High pressure. Do remember, we need to give it in high pressure. We need to inject the solution in high pressure with low flow. Right? This is to ensure that you are perfusing the tissues correctly, appropriately, so that the perfusion will be better and the preservation will also be better. Preservation of the body will also be better. That is why we have to do it. And suppose you do embalming of the dead body. When you do embalming of the dead body, what happens to the skin color? Right? What happens to skin color? If you look at the skin color, see, for a normal person, after embalming, it can become brown. Right? Sometimes gray as well. But if the person dies of jaundice and you do embalming, the color of the skin will become green after embalming. That is because of the reaction between the embalming solution and the bilirubin which is present in the body. Do remember, this is one very important point. It was asked in your previous JIPMER exam as well. Now, as a result of embalming, what happens to the body? You know very well that the body is getting preserved. But in addition to the preservation of the body, what else is happening? Do remember, number one, it alters the appearance of the injuries. It alters the appearance of the injuries so that the injury interpretation will be very difficult in an embalmed body. right? Interpretation will be very difficult. And not only that, it produces a kind of stiffening in the body, not like rigor mortis. This is called chemical rigor. This is called chemical rigor, and do remember this chemical rigor is permanent. Fine. It is chemical rigor. It is very difficult to find the times and states from your rigor mortis. Fine. And one more important thing, all the poisons in the body will be destroyed. The formalin which we are injecting, is going to destroy all the poisons from the tissues. So after embalming, if you are doing autopsy, sending the tissues to the forensic science lab for poison detection, you will not be able to find out anything, because already all the poisons is destroyed in the body. Fine. And that is the reason why never do embalming prior to autopsy, particularly in a poisoning case. Right? Never do embalming prior to poisoning case, because it is going to disturb the entire poison. And not only that, I told you injury interpretation will be difficult, postmortem changes interpretation will be difficult. Not only that, this kind of embalming will be dislodging all the thrombus and the clots, right? Your postmortem examination will be difficult after embalming. And that is the reason why, do remember, you should never do embalming prior to autopsy. Never, never, never. Okay? If a person does embalming prior to autopsy intentionally, you can remember it is punishable under 201 IPC. Why is it punishable under 201 IPC? Because it amounts to intentional disappearance of evidence. Right? When you are doing embalming, you are losing all the evidences. And that is the reason why if anybody does it intentionally, it is punishable under 201 IPC. This was one of your previous AIMS exam question. And you can easily see that these are all the disadvantages of doing embalming. Okay. Injuries interpretation will be difficult, the chemical stiffening will be there, poisons will be lost, and dislodging of the thrombus and the clot. Fine. So this is what is embalming. There is one more terminology that we have to learn, that is called entomology. What do you mean by entomology? It is a study of insects. You know, entomology is a study of insects. We have something called, what we are dealing with is not this exactly entomology. We are learning about forensic entomology. The application of entomology knowledge in the forensic purposes, in the administration of justice, we can say that is called forensic entomology. Forensic entomology. Right? And what are the common insects that are relevant here? You may have a lot of insects, but what is so relevant here? Do remember 3 insects. Number 1, that is housefly, which is Musca domestica. Housefly. And second one is blowflies. Blowfly, which is called as Californidae. Californidae. Right? And the third one is flesh fly. Flesh fly is Sarcophagidae. Sarcophagidae. So do remember, these are all the 3 important species that we have to learn for MCQ purposes in entomology. When housefly comes, when a body dies and body is in the open place and the housefly comes and lays eggs. Right? So let us say this is the housefly which is laying eggs. Right? After some time, the eggs will hatch into larva. And you know very well, larva is otherwise called as maggots. Right? The larva will develop into what is called as pupa or pupae, plural. And then the pupa will develop into fly. This is the sequence, life cycle of an insect. And you can see this takes around 8 to 12 hours. You can say this is also 12 hours, 3 to 6 days and 3 to 6 days. You may not need to know exact time for each stage, but what you have to remember, on an average, it takes 1 to 2 weeks for the entire cycle to get completed. When the housefly becomes lays eggs and everything, again it is becoming housefly. From the egg to the housefly, you can take, at least it takes 1 to 2 weeks. 1 to 2 weeks. For the maggots to appear, if you see maggots in the body, you can say around 6 to 7 days for maggots to be seen in the dead body. Now, while you are studying the insects, what is so important for us? What is the medico-legal importance? Why should we learn about the insects which is there in the dead body? Number 1, it will tell us an idea about the place of disposal, so that can be identified from the type of species of insect present in that. We know very well the species will differ from place to place. So based on that, we get an idea about the place of disposal. Not only that, the most important one point is time since death. Depending on what stage of the insect that is present in the body, we can approximately find out the time. That is second point. And the third important point is, in a case of poisoning case as well, this is highly useful. Right? Why insect is highly useful? Person died of poisoning. Insect did not consume poison and died. The person only consumed poison and it died. How this study of insects will be useful? Remember, let us assume person died of cocaine poisoning. Let us say OPC poisoning. Body is getting decomposed. Insects grow on the body. When the insects are growing on the body of a person who died of OPC poisoning, these insects will eat the flesh, the muscles of the soft tissues of the dead body. The OPC poison which is present in the tissues of the dead body will also be found in the body of the insect. You take the insect, send it for analysis. This OPC poison may be found, may be detected. This kind of study is called as entomotoxicology. Right? Toxicology, entomology, you merge together, it is entomotoxicology. Right? So how to preserve this insects? Right? It has to be preserved in absolute alcohol. Right? So that is the ideal preservative by which we can preserve the insects. Sometimes we can also use hot water. Fine. So this is the ideal solution. So this is about entomology. You can see the insects. Right? You can see the insects. Flies. Right? You can see this is adipose hair formation and this is mummification, completely dried up. So we have discussed in detail about the putrefaction. The earliest sign of death, I told you, that is loss of voluntary movement and unresponsiveness. If they ask you what is the earliest eye sign, the earliest eye sign is basically the Kevokian sign, because it is a sign that is due to loss of circulation, right? Fragmentation of retinal vessels. So basically it appears within few minutes after death. If they ask you what is the earliest sign, external sign of putrefaction, the earliest external sign of putrefaction is right iliac fossa discoloration. Earliest external sign of putrefaction, right? That is basically right iliac fossa, green color discoloration. That is the earliest external sign of putrefaction. Okay.